If you can hear my fan going, I am so sorry. We are in the middle of a heat wave, okay? It's like 40 degrees out. I'm dying. It's also why this is happening. I can't do my hair. My fringe sticks to my forehead in the most disgusting way. I can't do it. Anyway, hi. This is my 1 year scarification update. Truthfully, I did always plan on making this video like this second I booked my scarification appointment, because while there are plenty of scarification healing posts, videos, timeline things out there, there aren't that many people who will actually follow up after the first month to kind of show you how things are going. And I personally always find that very, very interesting, actually even more interesting than initial healing for most mods, because bodies do take a long period of time to heal things, even if it's just a piercing or just a tattoo, and they're going to change over time, especially with something like scarification, where you can't really predict or influence the outcome that much. At the end of the day, it really just boils down to how your body heals wounds. And I just always find it really, really fascinating to see how differently scars heal on different people, on different body parts, on different skin colors, because there's stuff related to wound healing and melanin that's too much for the scope of this video. I just find it really, really interesting to see. If you enjoy these types of videos and you would like to see me make more, maybe even on some other mods that I've shared on this channel, please do let me know by leaving me a like, and maybe consider subscribing so you never miss another one of my videos. Also, before we start, let this be your content warning. There are going to be close-up images of scar tissue. I might even put in 1 or 2 pictures of when it was freshly done, so an open wound and blood type situation. If you are sensitive to any of these things, I'll see you in the next video. And if you aren't, let's get into my 1 year scarification update, and also a tiny little FAQ Q&A situation of I think it's only 3 questions, but I get those all the time, and I thought I would answer them in this video while we're here. So I did make a really, really long healing diary type video when I first got my scarification a year ago, which I'm going to link up here if you haven't seen it yet, which maybe you haven't, because I had a third of the amount of subscribers that I have now, which holy that's actually insane. But just to kind of recap and give everyone a chance to catch up, if you don't want to watch 2 20-minute videos in a row, because I have a feeling this one is going to be long, as always, I got this tooth scarification a year ago at the end of July in 2025, and this is what it first looked like. I did go into the cleaning routine a little bit more in depth in my healing diary, if I remember correctly, but just to recap, I did kind of a combination of what my mod artist recommended, and I am blanking on the person's name. Russell Fox, perhaps? Probably not. I'm going to put it here. And this well-known mod artist suggested aftercare routine on his website, which was essentially cleaning the wound 2 to 3 times a day with hydrogen peroxide. I did also pick out any bit of scab that was starting to form inside the wound, and then I would basically spackle it, because it was deep. You can probably see after the cleaning, I would essentially spackle it with Vaseline just to prevent my body from being able to heal this as quickly as possible, and in turn have my body produce more scar tissue, because I wanted the scar to be as pronounced as possible. So I really did follow through with this cleaning regimen for, I think, 2 weeks. It was very, very, very annoying. I didn't do the really hardcore stuff with rubbing in sugar or sesame oil or salt. I think some people do as well. I really just did the hydrogen peroxide cleanings, and speckled it with Vaseline, and then I kept it wrapped up in cling film. And I think that was pretty much it. And then we ended the last video with my scar looking like this. A beautiful pinky color, very tender flesh starting to form in the tooth. A lot of the details were still very much visible. Some of them had already started to fade, which I knew was a possibility, which my mod artist also told me, because like super fine lines don't tend to stick around too much on scarification, which is why you would usually get like thicker strips of skin cut out just to ensure that it is as visible as possible. I did take notes about healing, about the changes I noticed. I was a lot more diligent in the first couple of months after, and then it did kind of fizzle out. And I will also admit I kind of forgot about it. So let me go through my notes. I don't remember if I actually mentioned this in my last video about my scarification, but towards the end, the skin, like inside the tooth, if that makes sense, got really, really dry, and the scar itself also was very, very dry. The first note that I have, which is from the beginning of September, so the scar was like a month and a half-ish old at the time, was super itchy and getting more raised. Skin around it recovered and isn't dry anymore. The scar itself is still very dry though. And by super itchy, I really mean like insanely itchy. I have never felt anything like this before. Like if you think you've ever had a super itchy tattoo during healing, scarification, it's absolutely nothing compared to the itchiness that I had with this scarification. It drove me absolutely insane. I wanted to strangle myself because it was so annoying, because it wasn't like a surface level itching that would just go away by scratching. It was like, it felt like my bone was itchy. A couple days after my first note, I wrote a second one which said, itching has turned into pain, ? Specifically along the outermost long lines, like almost borders to normal skin, but only on the outside. And then I put like this emoji combo because I for some reason couldn't articulate what I meant. I still can't. I do remember the like very, very intense pain. I can't even compare it to anything. It wasn't shooting pains. It was kind of like, you know, when you stub your toe and you're just like convinced it's broken because it hurts so bad. It was kind of like that, with like a combination of when you hit your elbow on something. That's like the only thing I can compare it to. It was still a little different, but that's kind of the gist of it. And it wasn't itchy or painful all the time, but when it happened, it was the absolute worst. And I do remember this lasted until like mid-October, I want to say, where just like a couple times a day, I would either get pain or it was really, really, really itchy. Obviously nothing like unbearable most of the time, but there were absolutely times where I was like, why the did I do this to myself? The next note I have is from late November, so there was like a good bit of time in between those entries. You can tell I was starting to slack off. Laid on my stomach / propped up on my elbows for about 4 hours while getting tattooed, and the left outer border, so I think this bit perhaps, feels like I scraped my elbow. So do with that what you will. I'm not even sure if that necessarily had anything to do with my scarification, because I do remember that I wore like a ribbed knit sweater, so I might have just laid on it funny for, again, 4 hours. But for the sake of this video, I'm saying it. Then at the beginning of November, I started getting random shooting pains in my scar. And I said, it feels okay most of the time, but like static sometimes. The outer borders are a little bit more raised and darker every day. Then the next note, which is at the end of November, says, insane, in all caps, shooting pains when holding my arm up for longer, like doing roller sets. Obvi has to do with blood circulation, but WTF. Also goes very purple when it's cold. Overall, a little splotchy up close and unevenly raised. The outside borders of the tooth are much thicker, which they still are. I will show you what the tooth looks like right now in a second. Anyway, that is still kind of what it looks like. And again, it was something I knew could / would happen because it is on an area that moves a lot. It is like a fleshy bit. And obviously all of those things affect how scars heal, right? If you move your arm a lot, if it rubs against clothing a lot, it's going to affect the outcome of your scar. So I knew there was the possibility of it being kind of uneven. Yeah. Then I stopped taking like detailed notes with dates and stuff because I got kind of sidetracked, and I think not a lot of interesting stuff was happening with my scarification healing. It was just a lot of the same over and over again. I would get shooting pains. It would get darker purple when it was cold. It would hurt. But around like January, February, perhaps March, again, not entirely sure, stop being very diligent about notes, unfortunately, is when like the top and bottom bits, so the parts that don't move as much when I move my arm, started going white or like a light pink and then transitioning to white. And then it would just like start spreading a little more every day. And this is what it looks like right now. I think you can see very, very well exactly where the skin on my arm moves the most and where it rarely moves at all, which is so cool to see just like the pattern of movement represented in like a static way, if that makes sense. I don't know. I think it's the coolest thing ever. But that is what my scarification looks like right now, 1 year in. It is uneven. Most of the details did get lost, but at the same time, I am so surprised at how light it already is and how well parts of it have already healed and turned into just like a nice light scar. I think the way it is healing, and it will hopefully continue to heal, is very, very cool. You can absolutely still see that even the lightest parts of the tooth aren't fully healed as much as the other scars in the surrounding area are, which I'm not surprised by. Generally, my scars take about 2 years, give or take, to get to like a very even color. So I was not expecting it to look even this way, honestly, at this point, especially on the inside of my arm where you have like the squishier, softer skin, is very thick compared to the other side because they were done in like the exact same thickness, obviously. But this is scarring a lot more. Again, skin texture differences. Is that the right word? I'm not really sure. It's not super surprising to me considering the outlines of the tattoo right next to it have also scarred heavily. And I think it does just come down to how the skin is like made up here. Yeah. I still do get like scar specific shooting pains when I hold up my arm for a long time, like doing my hair, stuff like that. It does still get super, super itchy when I'm hot, which I've noticed recently because of the many, many heat waves. But that is kind of it. I try, and I have tried during this whole healing process, to scratch it evenly when I do scratch my scar, because any kind of trauma or like further trauma that you apply to a healing wound will make it heal / scar differently. And I tried my very, very hardest to like scratch all over to keep the line weight, I think it's called, as consistent as possible. While I have you here, let me answer my 3 FAQ questions just to round out this video. The first question I always get when people notice it, when I talk about having scarification, is obviously, did it hurt? And I did answer this in my last video already. The procedure itself, like getting the bits of skin cut out, felt a lot like getting tattooed with a very, very small needle, which I always find the most annoying and the most painful anyway. But just a bit sharper, smoother. And there also isn't like the vibration of the tattoo machine to kind of disperse the pain or distract you from the pain. The healing, at least the way I did it, does not compare to healing a tattoo at all. I know there's people who just get the pieces of skin cut out and then do nothing to their scars, but the way I did it, the healing regimen I did, horrific. I did really expect the initial procedure to be way worse versus the healing, which turned out to be the complete opposite. The second thing a lot of people ask, especially recently, is it going to even out? Probably. I really cannot say for sure, because that is just part of scarification, is not knowing what's really going to happen. It might take another year, might take another 2 years, but I am positive that it will all eventually be just like a very pale scar. Thickness wise, I'm unsure, and I'm leaning towards no. If anything, I could see the bit here that is thicker now, maybe spreading out even more. It's a big experiment. It's a big gamble at this point. I don't know. And the third and final question or comment that I got surprisingly multiple times recently, even though I posted my scarification diary a year ago, was, why are you using hydrogen peroxide on it? You're not supposed to use hydrogen peroxide on wounds because it kills all bacteria, even the good bacteria, and you need bacteria for it to heal. Yeah. Hydrogen peroxide is outdated wound care. And it's simply because that is what my mod artist recommended. It's what a lot of mod artists recommend if you do any amount of research into scarification, to help promote scar tissue, as far as I'm aware. Don't quote me on that. It does make sense if you think about it for like 0.2 seconds before commenting. If you kill the good bacteria in the wound, and if you scrape out any attempts of your body of trying to heal this wound as quickly and as seamlessly as possible, you're gonna keep the wound open for longer. It's going to take your body longer to heal it, which signals to your whatever cells they are that they need to produce more scar tissue, which is typically what you want if you get scarification, is it not? Yeah. I think I even said in my last video, I use hydrogen peroxide to clean my scar because it's what my mod artist told me to do, and not because I think it's like the height of wound care. And that concludes my 1 year scarification update. I hope I could answer some of your questions, stifle your curiosity. Of course, if there's anything else that you would like to know about my scarification, please do drop me a comment. I love chatting with you. Also, let me know if you have scarification, if you plan on getting scarification and that's why you're watching this, perhaps. Or if you also just like teeth, like me. As always, thank you so much for hanging out with me today and listening to me yap about my scarification. An extra special thank you to my channel members. If you would also like to become a rap baby, you can join up here. And I will see you in the next video. Bye!
I'm glitching.